Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Drugs which decrease the estrogen or management of hyperestrogenic conditions include oral contraceptive pills causes endometrial atrophy on continuous use. Oral contraceptive pills are the first line drugs. Progesterones are given continuously. When given continuously decreases estrogen and thus they can be used in hyperestrogenic state. Gonadotropin releasing antagonist, if given continuously, is the drug of choice and it decreases the estrogen and it is used in the management of hyperestrogenic states. Gonadotropin releasing hormone agonists is the drug of choice, not antagonist. Gonadotropin releasing hormone agonist is the drug of choice when given continuously. Gonadotropin releasing hormone antagonists, if given continuously, letrozole, that is aromatase inhibitor, and danazole or gestinone is an anti-androgenic. All these can be used in decreasing estrogen or used as management of hyperestrogenic conditions. Danazole and gestrinone has androgen side effects. Danazole and gestrinone are the anti-estrogens and they have androgenic side effects. Drugs which decrease progesterones include mifepristone or RU486. Drugs which decrease progesterone are mifepristone and RU486.
thank you and thank you for watching.